Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spill, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview.
Hello, today I'm talking with Dr. Elizabeth Winings, a doctorally prepared nurse practitioner specializing in psychiatric and lifestyle medicine. She is founder of Winings Wellness in Jacksonville, Florida, where she brings her passion for lifestyle medicine into her mental health focused practice to help children and families with a wide range of concerns like anxiety, depression, ADHD, and weight management. In addition, she teaches the next generation of nurses at Jacksonville University and is a contributor to the Lifestyle Medicine DNP program at Florida State University. Dr. Winings completed her undergraduate and graduate degrees at University of Florida and pursued her advanced training in plant-based nutrition, completing her doctoral internship in nutrition and lifestyle medicine at the True North Health Center in Santa Rosa, California. She is committed to a whole person approach composed of physical, mental, and emotional health. Dr. Winings is an example of how a doctorally prepared nurse can not only practice at the top of their scope, but displays true leadership in the field of both nursing and nutrition. Welcome, Dr. Winings.
Thank you so much.
Let's begin. So first, can you provide an overview of your role as a nurse and advanced practice nurse, also practicing lifestyle medicine, and how it differs from traditional nursing roles?
Absolutely. So I am a nurse practitioner who is certified as a psychiatric mental health nurse practitioner. And that certification allows me to take care of individuals across the lifespan. So from pediatrics through adult and geriatrics. I've chosen to subspecialize into pediatric population. So that's my primary role clinically under that certification. Then I also sat for the lifestyle medicine exam. And so I carry that certification as well. And I have the privilege to blend those two disciplines in my day-to-day care as a psychiatric nurse practitioner. When individuals are looking for mental health care, whether that is therapy or medication management for their child or maybe themselves as an adult, that is typically the role that I am filling, is that they are looking for a traditional need to be met, such as treating anxiety, depression, or ADHD. But because of the training I have, my lifestyle medicine training is woven into that traditional mental health care. So I practice where I don't believe you could do one without the other. I think when we look at individuals who might have different training and they specialize in lifestyle medicine, they are learning about mental health and they are incorporating mental health and behavior change into that as well. So I feel like I have the best of both worlds where I've been able to train in psychiatry and mental health care as well as lifestyle medicine because they blend so lovely.
Beautiful. Thank you for that. And it is really a whole person approach, not isolating the mental health from the rest of the person and that person, especially your pediatric focus within that family that you're describing there. What motivated you to pursue a career in lifestyle medicine? And was there a specific event or experience that really inspired you?
There was. I had my first job as a registered nurse at the Veterans Hospital in Gainesville, Florida, the Malcolm Randall VA Center. And any nurse or resident or other health specialty, if you train at the University of Florida, there's a high probability that you have walked those halls or had some patient care at that VA. It's an amazing teaching institution. And I had the privilege of working on a surgical floor. And a lot of the patients I took care of were having complications due to uncontrolled diabetes. And as a new nurse, I believed that diabetes was an illness that you may have for the rest of your life, but it should be controlled through insulin or maybe over oral medications and diet and lifestyle. There were diabetic nurse educators, and it was very confusing to me that individuals would have a severe complication of diabetes, losing parts of their body. I took care of individuals who were having amputations, whether that was a toe, a foot, below the knee, or even at times above the knee. And it was very jarring for me to take care of individuals who, when I met them, had their entire body intact. And then I was taking care of them and helping them cope with the loss of limb. And I would talk to the surgeons about that. And they were not as interested as I was in my curiosity of what could we do differently. They were doing what they were trained to do. They were putting in the consult for the diabetic nurse educator. They were making sure they didn't have infections and encouraging their patients to make different choices than they did maybe that led to this surgery. But there was a registered dietitian on the floor who, after I was caring for a patient that had initially just had one amputation, second amputation, and within a year, this individual had 3 amputations. And that registered dietitian handed me The Omnivore's Dilemma. And that was the first book I read. It's written by Michael Pollan. Just that really opened my mind to realize there is another world of knowledge and a body of research and evidence that is growing. At the time, this was 2011. At the time, plant-based nutrition wasn't very popular. It wasn't common language. Lifestyle medicine wasn't really common language at that time. And so I'm very grateful for that registered dietitian. And then as you can imagine, the documentaries I was able to watch, Forks Over Knives and all of those other food-centric, lifestyle medicine-centric documentaries really gave me courage to keep asking questions. And here we are. So I not only rerouted from thinking I would be an acute care nurse practitioner to psychiatric mental health because I was very curious about how we make decisions as humans. I also now get to really be immersed in lifestyle medicine. So that time at the VA was very pivotal in shaping my practice as a nurse and nurse practitioner.
Wow. Such a powerful story because it was the experience of witnessing those loss of limbs, a person losing part of themselves, and then one patient with the third amputation, that experience. And then that book that someone handed to you and a window opened, a door opened, and the synergy of that. Thank you. That I get chills just hearing that story. That's so powerful. Thank you. So it sounds like lifestyle medicine is everywhere in your daily practice. Can you give some specific examples of how you do that, how much you're allowed to within the scope of your practice in terms of time? And then also if we can combine that with thought about strategies for educating and empowering your patients including that really important part, which is keeping them going on that beyond that visit, beyond that intervention or that little jump start or whatever that they do.
Absolutely. I think this is an evolving skill. And what I have had to learn is sometimes I can see a problem and a need, a way to meet that problem. So I might identify that my patient could benefit from eating more whole foods or drinking more water or getting more sleep or moving their body. Maybe it's just one of those in one patient, or maybe it's all of them. And what I've had to learn is that the patient needs to lead where they'd like to start. So I can get curious with them about what might be contributing to their specific complaint in this visit or concern, or even just treatment goals. A lot of times I'm working with individuals in therapy. And so we might be working towards an emotional treatment goal or a relationship treatment goal. So getting curious about how their quality of sleep might be contributing to how they feel. Specifically, what I take a lot of pride in and I'm very grateful for is I like drinking water just as a person. I know that not everyone does. So I think it comes naturally to me for that to be a leading lifestyle medicine discussion. And when individuals are able to just get curious about how much water they're drinking and increase the amount of water they're consuming, they start feeling better. And that gets me some buy-in for other conversations. And specifically with children, there's so much research in the pediatric and adolescent population that being hydrated contributes to academic performance. And so that's a nice fact to present to kids. And a lot of times they're competitive, and I give them permission to come back and tell me it didn't work. You drink water and you come back and tell me next time if you noticed a difference or not. And I feel like that is something that gets some buy-in. So I would say my strategies for weaving in lifestyle medicine to traditional psychiatric care is being curious, allowing the patient to join me in that curiosity, and then meeting them where they're at. Because when we look at behavior change, we know most individuals who try to do more than one specific behavior at a time will give up. They might be successful. There are rare cases where people may be wildly successful, but most people will fatigue. And what was a previous behavior pattern will take back over.
So individualizing it, being really curious, going for their why, what's important to them, giving them permission to come back to you and say, it didn't work. It's okay to come back to not feel like, oh, I can't be honest because I don't want to disappoint. And then looking for that win, and the amazing story of water and hydration. Wow. Thank you. And then, so they're getting these successes. And then in terms of continuing with that, what you're saying is that you build on that win.
Mm-hmm. Yes. So when we think about theories that contribute to successful behavior change, we have to move through this pre-contemplation, action. We have to get between action and maintenance before we really layer in another behavior change. And we have to be mindful that we're all human. Someone may be wildly successful for a season and experience a life stressor and regress in some of their behaviors that are contributing to a healthy lifestyle. That's not a failure. And I think all humans have defense mechanisms where we can be critical with ourselves or feel disappointment, which is a normal human emotion when something goes wrong. And I think as healthcare providers, we can hold space for individuals to wrestle with those and move through them, and then get back to those healthy choices. And I think when we lose the relationship with our patient, when they feel this sense of, I don't want to disappoint you, or they're just asking me to do too much, that's when it's a true disappointment. And so my hope is that my patients always feel that they can come as they are. And whether you've drank water for the past week, it's not going to matter. Yeah, we might talk about it, but there's not going to be a sense of disappointment or blame or shame. And I think that is the long game where we truly see lifestyle behaviors that can be sustained.
So important. I love that term, that idea and that concept, the picture of holding space for our clients, and also the timeline. I think we're in the microwave age. Okay, did the water this week. What's next? What's next? And put all this pressure. On one hand, you're encouraging the younger people. Hey, a little bit of they're competitive, that may help with schoolwork. But on the other hand, no failure here. It's just a journey. It's an ongoing journey. Beautiful. Challenges. Can you share about some challenges that you encounter when promoting lifestyle medicine to your patients and how you overcome those and help them?
Yes, I think some of the most common challenges are time, individuals feeling a sense of exhaustion and maybe disbelief of one more thing. Is this really going to make a difference? Can't we just do a medication? So I think exhaustion and disbelief that sleep, hydration, moving your body, eating real food, spending time with people you like, getting some sunshine could be so profound. And so I think the ways that I overcome that is allowing it to be present and sitting in that discomfort with my patients. And that's hard. That is very hard. And not all healthcare providers are trained to do that. I would say the therapeutic use of silence and curiosity is one of my favorite skills, because sometimes when I am with a patient, it may be the only time in their day that truly no one else is interrupting them. And we can sit in silence, and not awkwardly, not for a long period of time. But I would say there definitely are barriers, and that's going to look different depending on the patient. But I would say thoughtful moments of silence and reflection and allowing them to draw new conclusions can be really powerful for moving through that. And then I would say challenges with working with children is that they may have a different idea of what's important right now versus their parent. And so being a translator, helping translate what's important to that parent to the child, and helping the child or adolescent message get translated to the parents. So I would say those are my challenges. Is sometimes I have two people asking for completely different things. Both are valid. So how do we figure out where to start? That just takes time, but we figure it out.
Yes. What an important space, because you are dealing with that realm of the child and the family, both so important to the other's success, and that they maybe have divergent pictures of that, and how to listen to both and bring that together for their success. And one of the key things that you stress over and over again is being present for all of that, and taking that in and meeting people where they are, and helping. And ultimately, as you said in the very beginning, it needs to be their solution, where they want to go with this journey.
Correct.
Beautiful.
As healthcare providers, we typically know the treatment plan or intervention. It's not that we're doing something different with every single patient, but if the patient is not invested or leading, it's not as meaningful. And I learned that very quickly as a new provider, because I would feel discouraged. And then I realized I wasn't creating space for my patient to fail. And I was creating a lot of expectations, and it was unreasonable. And when I learned to step back and allow the patient to lead, and allow them to have space to say no, or that didn't work, I grew exponentially in my buy-in with them. And that's the long game. And I think that's the challenge of healthcare for different specialties. Sometimes you truly only have a small window with patients, and you're trying to accomplish so much. I have the privilege of seeing my patients weekly if needed for 30 to 45 minutes. And I know that's not every specialty. So I think the nuances vary depending on the encounter you're having with a patient.
Mm-hmm. But again, within all of that, underpinning that, it sounds like what I'm hearing is that relationship. It's so key. And the relationship has to be built on that trust, but also that you're letting them lead.
Yes.
Even though, like you, as you're describing, we have all this knowledge, we could tell the same thing to all of our patients. There's the science, this is what's successful. But when we set up expectations and people are failing, or it's not what they want to be doing, yeah, we have to describe that uncomfortable space, be willing to be uncomfortable ourselves.
Yeah.
Because our patients wrestle with some of these things, and as it takes longer, we want them to have this today, yesterday. Yeah, thank you. Can you share, we all love a story of a patient or a group, an experience that was really moving and emblematic of just the beauty and power of all of this, including something that was really maybe hard. And then what some story that you'd love to share with the audience.
There are many. So I will share one about working with children who have ADHD. There are a lot of conversations around the treatment of ADHD and the diagnostic criteria. And I think what's important when we're working with children who have ADHD is that we are finding space for them to be their truest, fullest self. The world is not built for people who are highly active or impulsive or like to daydream or be wildly creative. A lot of times these children experience disappointment, and they internalize that because once they start to realize I'm to this or I can't do that, we can see a deflated self-esteem. And so I never want that. And sometimes it's hard to have buy-in from them to choose to participate in therapy and or maybe take medication and or choose healthy lifestyles. So I have this complex circumstance with many of my patients. I really enjoy working with children and adolescents who have ADHD. No matter how it manifests, I really enjoy it. It's like a puzzle. And one of the things that I focus on, and with this patient in particular, what we started focusing on was sleep. Because if you're staying up late or even on screens or phones late at night, we know that can impact your ability to fall asleep and quality of sleep. And so this patient was having trouble getting up in the morning, and so it was snowballing. So we started with sleep hygiene, and that was successful. And they were middle schoolers. So this is a child who has more autonomy over their life and can see more autonomy coming. And so one of the things that we worked on that was really cool was with the parents and building trust, because that was a treatment goal. How can we rebuild some trust? Because we'd had some impulsive moments that we didn't own right away. So there was some accusations of being a liar and or dishonest. And so building trust is very important to mom, dad, and child. And research shows that if you exercise in the morning, there's more research coming out, but some good research shows that if you exercise for a minimum of 10 minutes, and it has to be cardiovascular, we need to increase that heart rate. So that could be riding a bike, going for a brisk walk, or maybe even a jog. That can help align your brain in a way that minimizes your experience of ADHD symptoms throughout the day. And so this child, we had buy-in because mom and dad said that they could ride the bike for 10 minutes and come home. It was a way to earn trust. For me, this is a way to reduce the use of medications, which I love, conservative use. And it was a really fun case to work with. And this child is now in high school. Symptoms are well managed. They have this lovely lifestyle that they've already built in high school that can benefit them as they continue to go to college and be an adult. And it didn't come from a place of shaming them or if you don't do this, then you're going to have these catastrophic outcomes. And so I really enjoyed that experience. And I use that often when I'm working with other children with ADHD, hopeful that we can find what's the right fit for them. But I find that sleep and morning exercise is a game changer.
Thank you for that. That's so important how you have found those to be really underpinnings of success for children with ADHD, but then also in this particular circumstance with the trust and the relationship. So the family riding the bike together and doing that together, rebuilding all of that while that child gets under better control and relationships and time together. Oh, beautiful. Thank you. The next question speaks to where we are as nurses in these interdisciplinary spaces, including even in a university or government, in communities and all. Can you share how you collaborate with other professionals in all areas to integrate lifestyle medicine into patient care or into the community? And I guess from there also things that you'd love to see happening also there.
Sure. I think that's such a broad question. I could talk for a very long time on what I would love to see happening, but I'll speak to my current roles. I have the privilege of teaching at Jacksonville University, and I teach in the family nurse practitioner track and the psychiatric nurse practitioner track. And I have been able to submit a few courses for the partial pathway through the American College of Lifestyle Medicine. And so I am thrilled that I have had students who are interested in continuing to learn about lifestyle medicine because of that certificate. That is, I guess, it's like a voucher for them to continue towards that certification if they chose. So that's one thing that I have implemented in my role. And that has also been a way to educate my colleagues and get their curiosity on what is lifestyle medicine and have those conversations. I collaborate quite frequently with other therapists and local schools when I'm working with guidance counselors or school administration discussing patients. And so that's an opportunity to discuss the way school day is structured and children being allowed to have water in the classroom and or water breaks, how much movement is incorporated throughout the day, those types of things. Based on my clinical work, I'm primarily interacting with therapists and the schools for my patients, and of course, parents. And then I've had some wonderful collaborating physicians throughout my time working in the hospital setting. I'm no longer working in the hospital setting, but I still collaborate with physicians, whether that's a primary care provider or another psychiatrist. And one of the things I find is many providers will refer patients to me or my practice because they know that we will take time to get curious about what else is contributing to a child or an adult's symptoms. And we're not just prescribing medicine. We're having longer conversations. And I say I've had the privilege of hiring additional nurse practitioners who also provide mental health care, and lifestyle medicine is woven into that. So I'm very grateful. And when you say, what do I hope would happen? I hope to have many more nurse practitioners who are trained and certified in psychiatric mental health care and lifestyle medicine, because I think these conversations just bring so much joy and value to people's lives. And then they don't need us anymore. And that's the biggest compliment to graduate. You're always welcome to come back, but to graduate and truly feel like, okay, I can enjoy my day. I feel healthy in my body and I enjoy the people I'm spending life with. Wouldn't that be great if we all felt that way? And so that's where I think it's a much longer conversation. I think healthcare is so fragmented, and many providers are beyond resilient because they are providing care within this system that is rigid and fragmented and very confusing. And so I just have a lot of respect for anyone who is incorporating lifestyle medicine in a traditional healthcare setting, because I found that to be incredibly challenging. And that's why I opened my own practice, because the traditional healthcare model right now doesn't connect everything. It's pretty fragmented. So I think that would be a broad answer to say where I think we could just keep working to integrate a total person, a whole person in whatever setting we're practicing.
Yes.
Reimbursement should support that. We should be reimbursed for taking care of the total person, not just the procedures or other things like that.
Mhm. I love that too, graduating to the point where you can always come back, but
Sure.
you don't need me anymore. Or they say, I think I'm doing okay. I'll call you if I need you or if I'm
Right.
struggling. How beautiful that is. And to acknowledge what everyone in this field at all levels got into it for, and acknowledge the struggles to serve our patients within a very fragmented system, and to treat that patient as whole in a system that wants to cut things up and reimburse highly for procedures and not for the kind of care that you're speaking to, which is literally our presence, our ear, individualizing. And
Yes.
thank you. So how about resources and tools? We're almost at this point where we have so many amazing resources and tools. It's a beautiful problem to have almost. There's so many to pick from, but that you find most helpful supporting your practice and your patients in your clinic there, and then resourcing them beyond, whether it be literature, podcasts, classes, any of those kinds of things.
Yes, I think we have a wealth of knowledge, and there are so many passionate people who have created, whether it's YouTube channels or podcasts or free resources. I know ACLM has many for healthcare providers. I don't have any specific favorites. And what I will say is I do refer to nutrition facts quite a bit, Dr. Greger's content. It depends on the person. And I feel like sometimes I'm a filter because individuals will come and they are so inundated with knowledge that it's paralyzing because they're like, this person said that, and this person said this, and you're saying this, and then they are stuck. And one of my other roles I fill is working with the Plant Strong retreats, where it's with Rip Esselstyn and Jane Esselstyn. And we have the privilege of, it's primarily adult patients who come. Well, they're not really patients, they're participants. And we're doing an immersive experience where you get to live a lifestyle that is highly active, vibrant, nutritious, all these things in that week. And I find this sense of, what's the missing piece? Tell me more. What's the one thing? And most of these people are highly knowledgeable and already living a relatively healthy lifestyle. And so it's not that I don't believe in resources. I think they are phenomenal, and there's some really good ones out there, but it's going to depend on what your personality is. What podcast you're going to like is going to depend on if you enjoy listening to it. And so that may not be a very helpful answer, but I think what I find is if you're spending too much time looking for content, you're not living. And sometimes it's that simple. Go to bed by 10 p.m., sleep all night long, wake up, move your body, whether that's yoga or walking an ant like a pet, a dog, drink water, eat real food, and then see where you may have more specific needs. But I find that humans really want there to be a magic something, whether it's like a magic bullet or a secret exercise regimen or the perfect recipe. And it's, what did you eat yesterday? And I don't mean that to be insensitive to individuals who are truly knowledge seeking, but I think sometimes it's just so much more simple. We don't really need more information. We need to start where we're at and then build from there. And then if there's a specific identified need, it's easier to say, okay, here's a resource for that. Yeah. But I don't know how to say that without an example.
Yes, that's really powerful. You described yourself as almost like a filter, you said, because I think that there's so much, as you say, people are becoming paralyzed, and I'll get started when this happens, or I'll know enough when I've read that, or I when I'm walking in the woods, I have to listen to another podcast rather than listening to the birds. And
yes,
like you're saying, go to bed. Just be, yes.
Yeah. And I work with Dr. Esselstyn, and his primary patient population for his research was individuals with heart disease. And if you're an individual living with heart disease, we would recommend no nuts, no oil. There's just none. It's not worth taking the risk. But if you're a 5-year-old or parents of a 5-year-old, please let them have nuts or nut butters. We don't have to get into the minutia. And so I think that's where it gets very confusing. And then individuals get paralyzed because they want to choose the most right answer.
Thank you for that. All right. In your opinion, what would you say are the key barriers to the wider adoption of lifestyle medicine, the pillars in healthcare settings, and how that can be addressed?
That's a great question. I think the barriers are insurance. I am not a fan of our current traditional insurance models, even whether you're a veteran, if you're on Medicare, or you're using a commercial payer. I don't know anyone who goes, I love my insurance, but it just covers all of my needs. It's helpful. I think we have to be real and honest that it's broken and it's not benefiting the patient or the provider. And if we could find a way for reimbursement to be equitable, so that providers had time to provide care and patients could use their insurance to seek that care. This is really coming as a mental health provider. Most mental health care under insurance plans is a carve out. And what that means is you have to panel with another payer, and they reimburse at very low rates. And it's just very confusing. So that's number one. I think I wish I could multiply myself and become an expert in understanding that system, because I'm sure there are nuances that I'm not able to fully grasp from the insurance side of things. But I think until we have a way for people to seek healthcare that is not cost prohibitive, we will struggle with implementing true lifestyle medicine in all settings. And I think as a surgeon, wouldn't it be so cool if they were able to incorporate post-op visits or pre-op visits? I know when we're talking bariatric surgery, there are specific visits that have to take place, but where's the thread of lifestyle medicine that could support individuals who are making a step towards? I think those are my thoughts. What are the things in our current healthcare system that are benefiting the provider and the patient? And then what is not? So how do we problem solve that while holding the patient as the primary person who's receiving the positive benefits and outcomes? So I think that's a very complex system that we just have to keep having these conversations. And I think we need all the players at the table, not just the providers. I think my experience at the ACLM conferences and other healthcare provider conversations is that we're available to problem solve. Most providers are, and have some good ideas for how to implement more. So I think good things will come because the conversations are happening. So I'm curious about when will it change? I don't know that I remember the last part of your question.
Just how they can be addressed. You're answering all
Okay.
of that, and it sounded like really our model, our insurance-based model, and how it can be addressed. You're saying we're ready and able to have these discussions. We want to have them. We need to move this forward. And the interesting thing that I think I also heard you saying is that becoming we have a lot as practitioners in this realm to stay on top of and learn, whether it be on the side of the mental health or coaching, behavior change, to the science of that 10-minute exercise in the morning, things like that, to learn, stay abreast of the studies. But what it sounded like you were saying, is we need content experts on how to optimize so that we can keep the lights on, we can get reimbursement. Are there ways to even work within the system that we're describing here that is so broad and not serving our patients nor the provider, that we can work within that system to optimize the time that we get reimbursed for with our patients and the support?
Absolutely. Yes. And that's where I'm saying I'm not the expert on insurance, so I don't want to step into that. I just hear from so many people, whether it's my patients or friends, that they don't understand what their health insurance covers. Because when they have a need and they go have that need met, whether that's critical care hospital stay, and then I thought I was paying for the highest level insurance and now I have this bill, or mental health care, or all kinds of things. Psychologists. I would love to get a panel of psychologists, because I don't know any who take insurance, because much of the work they do is not covered by insurance unless you're working for a larger system. And that's such valuable information for children and families to have when we're looking for learning disabilities or processing disorders. So anyways, I just think this system became something I'm not sure it was intended to. And I want to hold that with curiosity. I can't imagine that the individuals who piloted health insurance wanted individuals to feel like they couldn't access care, or that providers weren't being reimbursed. Then I'm curious, all right, how do we keep getting people at the table to address this problem? Because our data is terrible, in case anyone is wondering. If you look at, healthy people, 2010, 2020, 2030, it's not like we're having these wild success stories as a nation and getting healthy. So it's not something that we should ignore or turn a blind eye to. It's an urgent matter. Like, most of our country is not feeling well, whether that's depression, anxiety, feeling overweight, having heart disease, being diagnosed with other chronic medical illnesses. So anyways, I just think that's the biggest problem. If the healthcare providers can't take care of you and you can't access them, that's really unfortunate.
Mm-hmm. And so remaining really open and curious about where are there opportunities to move this system to
Yes.
the way it needs to be, because it's definitely headed in the wrong direction.
Mhm.
Thank you. Talking about the research, we had spoken about that. Any hints on how you stay updated? We have such an exciting time also. In addition to the tools, we have so many, but also the research and advancements. And any ways that you particularly integrate that into your practice with your patients, some of these latest studies and advancements, tools that are coming every day out there.
I read and I encourage some of my high school and college students who are my patients to bring articles. I encourage them to get into the research. I have the privilege of working with second degree students in their nurse practitioner programs. It is just exciting. I feel like the body of evidence is going to continue to grow, and I love learning new things. So yeah, absolutely.
Yes, wonderful. That's so exciting that you're having that impact on those nursing students and able to connect them with these bodies of research that must be having their eyes wide open as they go through nursing school with the richness of lifestyle medicine and these studies that
Mhm.
are real eye openers, and so exciting because it gives them the power to have a change even at the bedside as a nurse before
Sure.
they even get to their practice at a different level, things that they
Mhm.
can implement when they walk out the door that day or sit down to their own meal.
That's my hope. Absolutely.
Oh, beautiful. Thank you. Any recommendations or advice for nurses just in the biggest sense of incorporating lifestyle medicine or following in this path? And then looking, so that's current and advice for nurses, and then looking ahead, where do you see us going in terms of the future of lifestyle medicine, looking at that bigger picture vision?
For nurses at any level, whether LPN, RN, APRN, I think trusting your training. Nursing is such a lovely person-centered model, and we are taught that from some of our very foundational courses, and we're taught about prevention, whether primary, secondary, tertiary. And so I think knowing that within you, there's already a foundation as a nurse for lifestyle medicine. It's a very easy incorporation. And so getting curious about what you already have within you, that is a foundation for practicing lifestyle medicine and wherever you practice as a nurse. And then on a personal level, if you're not drinking water, please, if you're watching this, pause it and go get water, or make sure that you're taking water with you in the car or to work or wherever you may be. Staying hydrated is so important for every cell in our body. And it's truly the first place that I start when I'm discussing lifestyle medicine. And then sleep. I would say those two elements, if you sleep well and you are hydrated, you are going to be able to show up as a good version of yourself. And where do I see us going? I think nursing curriculum will have lifestyle medicine woven within it because I already think it's there. Some of my nursing professors said, "What do you mean you're doing lifestyle medicine? That's nursing." So there's this very real sense of if we are practicing as nurses, we should be taking care of the whole person. Sure, there are nuances to the strategies and the skills that are more specific to lifestyle medicine and how we might practice that. But there's a lot that's already within us. And I think nursing curriculum will evolve to fully embody lifestyle medicine at all levels. I really do.
Yeah, I love that. I love that how you led off. Trust your training. We're already trained in this in such an amazing way, or we're already grounded. And then some of the professors saying, "What do you mean? This is nursing."
I
It's
taught you this.
yes, and it's just really developing it more, knowing those studies. But I taught you this. Yes.
Sure, there's new stuff, but you already do that.
I love it. And again, keep seeming to circle back to those key things that are so powerful. Take care of yourself, drink your water, and particularly that message for your nursing students, the water, drink, and get your sleep, and all other things will then give you strength to flow from that. And yes, thank you. Any projects or initiatives you'd like to share that you're involved in? It sounds like you're really in an exciting place at the university, both with that DNP
Mhm.
track there, and then teaching your students now
Mhm.
your MSN.
Yeah.
Mhm.
Um, a couple I'd like to share and give credit to. Dr. Ali Craig Rodriguez was a phenomenal force of getting curriculum created and launching the program at Florida State University. And so for nurses who are looking to do additional training and potentially that DNP, if you do not have it, that program is live, it's running. And so I've had the privilege to contribute a little to that mental health component, but that's live and ongoing. And I'm so proud of that program and excited to see continued students enroll. And then locally, I am in Jacksonville, Florida, and we are kicking off the Blue Zones Jacksonville project. And I have the privilege of contributing to some of the food policy conversations. And I'm really excited to just see where that goes. I'm just a part of a team. I don't really hold a role, but it's a project that I'm really passionate about. And I'm so grateful to have been brought into the conversation. I'm actively recruiting anyone who has tips or is local in Jacksonville and would like to be a part of this. Please let me know, because that is the goal, is that the entire community would evolve and adopt those lifestyle medicine tenets under that Blue Zones project.
Yeah.
And then my own practice, I have 3 nurse practitioners who are joining me throughout the course of this year, and just supporting them and their growth as providers and reaching more families with mental health care and lifestyle medicine. So those are really important projects currently. And maintaining the teaching role that I have at Jacksonville University, I just really enjoy it. And the students are inquisitive and excited, and they really want to be practicing healthcare. And so it's exciting to see that. And it revives me when sometimes I'm like, this is a lot. But to realize at the end of the day, it is really a wonderful job. And the moments that we have with our patients are precious. And I feel so fortunate that people would choose to have healthcare, and then that I get to be one of the people on their teams. It's really remarkable.
Thank you. That's beautiful. So exciting. The Blue Zones project there
Mhm.
too, in addition to all those other wonderful projects. And congratulations. We're all so grateful for the growth of your practice and
Thank you.
lifestyle medicine, nurse practitioners practicing in the mental health, which really is it's the whole person, as you say. Any ways that there's so many ways you've already talked about, but any specifics that you're measuring in your patients specific to lifestyle medicine interventions that you're working with them on?
Not in a formal way. There's no ongoing research in my practice. I would say in every single visit, we're talking about sleep, hydration, nutrition, physical movement, and who are you spending time with. So it's those 5 things. So those are discussed at each visit, and then you can see as the patient is progressing. And it's a nice way to reference if somebody's saying, I never do this. And then I can say, oh, actually, last time we met, here's what we discussed. So I would say those are my 5 things. And I have, my last name is Winings, so it's a W, and I have some water bottles that I have given to patients over the years, just with that little W on it. And one of my patients, a 5th grader, I said, and you know what the W stands for, right? And he's like, water. Like this, since we talk about it so much. And I was like, no, that's a great thing. I didn't even think about that. It was for Winings. And the intention was, even when I'm not with you, I'm thinking about you. And I want you to think about drinking water and me, that I care for you, even when we're not together. Because some of them I don't see very frequently, but that stood out in my mind. Okay, I talk about this a lot. It's probably annoying.
I love that. You know what that stands for? Okay, water. Yes, but I love that. That's beautiful. Want to move over and as we wrap up here to talk about something else and see if you see any connections and points of leveraging and that a 1+1 is 3 or 5 effect. In reflecting on the National Academy of Medicine's landmark report, The Future of Nursing 2020-2030, it's called Charting a Path to Achieve Health Equity. I wanted to know if I could ask your thoughts on how we as lifestyle medicine educated nurses can lend our particular insights, education, experience, and passion to this effort. And then a few just little notes from some of their media that they were trying to summarize is a couple of points of this massive and powerful report of and recommendations. So they describe nurses as trusted bridge builders who champion good health for all, exploring how we can and must unleash the power of the nurse to achieve health equity, and how the systems nurses function within must do more to educate, employ, pay, and enable nurses, support them so they can do more. Any thoughts about that intersectionality between this amazing future of nursing 2020-2030, really addressing what the spotlight of COVID shone on the social disparities of health, and then what we do as lifestyle medicine educated nurses?
I would just say yes, exclamation point. I agree with all of what has been said and is being requested. And I think my instinct is to say it's not the nurses that need to do more. It's the hospital systems, truly, because I don't know a single nurse who doesn't show up with their whole self, and no matter what's going on at home or if they're in graduate school, they are showing up and caring for the people in front of them. They might be grumpy sometimes, but they're doing it and they're practicing ethically. They're honoring HIPAA. And maybe this is because I work with children a lot, where sometimes I'm like, okay, parents, back up. Let's hear what your kid has to say. That's how I feel. Like, okay, hospital systems, please listen. Because if you look at the rates of applications to nursing school, they went up, and guess what's happening? They're going down. And when you look at the exodus from the bedside, nurses are not happy at the bedside, but they want to take care of people. They want to practice. They want to do what they've been trained to do. So I think it's a lovely initiative. And I think the answer is back up, allow nurses to do what they're trained to do and pay them. And I think that circles back to the distribution of what is happening within the healthcare system. Not an expert on it, have a lot of opinions. I'm very curious, would love to learn more. But I think that's really where the disparity is, that nurses, I haven't met a single nurse when I'm discussing lifestyle medicine tenets that rejects it or says, I'm not willing to do it. What they say is when or how. Yes, I would love for every single one of my patients that has a diagnosis of hypertension to learn these things. I don't know how to do that, right? Because there's all of these other things they have to get done. So I think it's a system problem, not a nurse problem.
And so what you're teaching at the level now with these students is they're hopefully, it sounds like they're feeling more empowered, given this next level of formal education on top of this is nursing, know your training. And this is what I taught you already from your nursing professors, but to say, okay, that's not enough. Here we come. We've got these studies now, and these formal certificates and diplomates and all of that, and formal programs at universities and tracks. And it sounds like we've got to be banging at the doors of.
Yes. And I will say, I feel so fortunate that one of the champions for the Blue Zone Project here in Jacksonville is our CEO of Mayo. His name is Michael Mayo, and he is the director of Baptist Health, which is one of our larger health systems here. And so I'm thrilled. I can't wait to see what some of these conversations are and how healthcare starts to shift locally. And I think what we need are health systems that are practicing this. And that way other health systems are willing to make a shift. I think there's a lot of fear when you talk about making change to cash flow for for an organization. So I think there's a lot of gratitude for the organizations that are taking the risks. I know New York has some hospitals that have definitely started paving a path. I know Dr. Barnard as well has his. I think it's just a matter of time, but we do need those systems and organizations to create places for nurses and nurse practitioners and physicians and other healthcare providers to practice.
Mhm. Yeah, so it sounds like part of it is just building it to places in the nation where in small and big spaces, in communities like your blue zones there, in universities, that we're building a new model, and then that could be a model for others too.
Correct.
This is how you make it work. It's a win for everybody.
And yes, it doesn't have to be a loss for anyone. I just think it's a matter of staying curious about how do we achieve that.
Mhm. Wonderful. Thank you for that. Lastly, wanted to ask, is there anything else you'd love to share about your experience as a nurse practicing lifestyle medicine? Any additional insights or thoughts?
Oh, I feel like I've shared so much. I am just very grateful. I'm very grateful that someone handed me a book in 2011 and said, maybe this will make you feel better.
Oh,
And I think that does speak to resources. And so if you're someone who may not fully identify or ascribe to lifestyle medicine personally or in your practice, stay curious because it's truly transformed my life personally, my family, my friends. So many people have just made tiny tweaks just because it's hard to deny some of the data. And when you start to feel better from living under these tenets that we're discussing that are called lifestyle medicine, and you feel better, it just becomes who you are. And so it's a privilege for that to be woven into my clinical care. And I'm just really grateful. I think what I would say, my kind of like concluding thought is humans heal. And so if we can continue to stay curious and be kind and create space for that, most humans can heal. Yes, there are very atrocious and devastating diseases out there, but if we can start making choices towards health promotion and practicing lifestyle medicine, many humans heal. Whether that's all things, I can't say that, but I can say that there are elements of our bodies that can heal and we can experience health.
thank you for that. Elizabeth Winings, it has been such a pleasure and an honor to share this time with you today. I have so much enjoyed it, and I am so thrilled that this will give the nursing community at large an opportunity to hear your voice as you ponder and share about your vast experience of your ongoing projects and the really both simple and powerful learning that you have garnered over your years of experience. And they can be as powerful as what you talked about, the book, the water, the glass of water. I will never forget these messages. And really, I take it away as something that we can use in our own lives and practices. We talked about some takeaways, but the clarity of these messages and the simplicity that someone walks away without 20 things, maybe one, and then help them on that journey, and then another one, and then it's beautiful. Thank you so much.
Well, thank you for allowing me to be a part of this and your interest in what I had to say. I really appreciate the opportunity.
Thank you. So we spent time today with Dr. Elizabeth Winings. And again, she is founder of Winings Wellness and among many other things. And thank you again.
Yes, you're welcome.
Elizabeth, thank you so much for taking time out of your priceless day here with all the things that you're doing. It's so great to officially have a conversation and all. And we'll share this out, and thank you. If there's anything else that you feel afterwards that you want to add or any afterthoughts,
You guys can edit it, take what's helpful. I said a lot, whatever is helpful.
It was beautiful and powerful. I hope it was a
Thank you.
good experience, and
Yeah.
it's really a really important message for our nurses out there. Thank you.
Yes. Thank you so much. And it was great to spend time with you.
Thank you so much. Same here.